Dr. Aaron Gum, founder of Blueprint Practice Automation, yourautomatedpractice.com. Today I want to talk to you about the knee pain niche. There's a lot of ways you can treat knee pain. Obviously there's an integrative model where you're doing stem cell. That's a great model, but not everyone wants to be integrated, okay? So we have to look at the model and how we can treat these patients, get phenomenal results clinically, educate them properly, but have it on a scalable platform where it doesn't involve a lot of your time, a lot of your energy, and it's empowering the patient long term. When we look at the old antiquated models, we have a lot of visits in the office, a lot of stations in the office, a lot of very expensive equipment that you need, which requires a lot of staff to run that equipment in those stations. So that requires a ton of time, energy, and money to service that. So what we've done is we've really looked at a different type of model, a hybrid model, in clinic, out of clinic, at home. And also one of the pain points that we see is the lack of education in the program that patient needs to go through the onboarding process. We have to sit down and talk to these patients about what knee pain is, why medications don't work, why surgeries fail, why you're going to get probably another surgery if that surgery fails. But we really don't have the time, energy, and resources to do that. And a lot of us skip this process and we wonder why we're getting lackluster results in the reported findings of patients accepting care from you. So what we've done at Blueprint Practice Automation on the clinical side, we have a hybrid model where they're coming in the clinic once a week. We'll teach you that in clinical once a week protocol, but they're also being drop shipped to FDA cleared devices at home. They're using an infrared device, a stimulation device that mimics a PENF response. They're using these home units at home 7 days a week, only coming in your office once a week, and they're getting way better results than any other knee pain program out there. And you're empowering the patient to their condition, okay? So along the way, another pain point we see is education. So that patient needs to go through some proper education before we go over that report of findings. We have all the pre-education automated for you. So the seminar, the pre-consultation education, the report of findings, even the patient curriculum once they become a patient. So they go through education online. They get a message every single day of the program. We're teaching them about knee pain, what it is, what caused it, dietary guidelines they need to follow, anti-inflammatory guidelines, seminars online to attend. We also have a nutrition kit that supports that process along the way. We teach them why they're taking it. So we've really scaled the model where they're only coming in your office once a week. We're saving extreme time, energy, and money, and staff time. We're getting way better clinical results because of the repetitive action of how our hybrid model works. They're treating themselves 7 days a week at home, sometimes twice a day if needed, okay? So we've really flipped this model upside down. We've saved time, energy, and money through automation. We've done a hybrid model for the clinical model. Patients get phenomenal results. So we pushed this antiquated model aside that requires a lot of time and energy, and we flipped it upside down and given you a model that gets clinical results proven. We have our infrared device, just that alone has 4 published studies with that technology. One of them is specifically against laser, gets way better results. So we've really given you a scalable model to implement into your clinic. So that's really what I want to talk about today, is really what the difference is in Blueprint Practice Automation's knee pain niche. All of our niches operate this way. We've really flipped it upside down and empowered patients and given you a scalable model. And also with the knee pain niche, we don't want to forget this, we can add a metabolic component now because we've really scaled it to a level where you can add a metabolic component to that knee pain niche, because every pound you're overweight is 4 pounds in the weight-bearing joint. So you can only imagine people come in your office 30 pounds overweight, 120 extra pounds in the joint. Now we have a model that we can add a metabolic component to it. And also with Blueprint Practice Automation, that whole metabolic niche, we have it all automated online. So that patient goes through that program, they get taught the metabolic niche the entire time. They can log their food, their water intake, their activity, they can journal, they can add virtual questions to the clinic if they have a question about that part of their program. So we've really just transformed this niche model to save you extreme time and energy in the long run. So if you have any more questions, jump on our webinar. It's in the comment section below. You guys have a blessed day. We'll talk to you soon.